Has that been met? I'll let you think about that. Okay, but there were some of the big targets and goals which as health professionals we needed to be mindful of. Another one as well, a 5-year forward reviews, a better care fund, which was published a policy framework requiring for a more integrated joint approach between NHS England, local authorities and Association of Directors of Adult Social Care. So in English, what this actually meant was that there was going to be one pool of funding rather than ring-fenced budgets, which is a huge change to actually how health and care professionals work. So basically what it meant is that it was trying to relieve the pressures from health professionals discharging patients from hospitals. So it's about trying to have a much more coordinated and integrated approach in making sure that patients can be discharged and can free up beds for new patients come in. It's quite new, this policy, so you might want to just spend a bit of time researching it, looking at it and looking at what does this mean in terms of the role of the professional and meeting the targets. So lots of literature that we can work from. To be honest, I think the Better Care Fund is a really good one, as well as looking at some of the old policies from Choosing Health, which is about cutting numbers of people smoking, obesity and diet. So I think that one, this one here, Better Care Fund, would be really good for you to look at and try and anchor into your work, explaining what does that mean to professionals. Moving on for 2.3, we've got discuss the role of routines for professionals. So again, it's about promoting exercise, it's about looking at healthy eating, hygiene. It's quite an easy one, that one. You also need to look at the different overarching structures, organisations supporting healthcare professionals, so your clinical commissioning groups, which means that doctors now have got more responsibility with budgets now, looking at the area, looking at what services is needed, no longer about the primary care trusts. National Institute of Clinical Excellence, they produce lots of guidelines for health professionals. Got Public Health for England, and obviously the role of charity organisations as well. So we'll need to see some explanation of how that works within the sector. And that's it for 2. Learn outcome 2. Just moving on. So in terms of looking at the next one, so you will then need to be looking at how health beliefs relate to theories of health behaviour. Okay, so for example, we know that many people have got religious beliefs, come from different parts of the world, got lots of rich culture there. We need to be looking at how that might actually affect patients and what choices they're making in relation to health promotion. So for example, religion is great, it can be a great source of psychological strength for patients, but again it might cause complications in terms of promoting health promotion. So if someone was maybe really sick and might refuse maybe antibiotics or maybe like injectables for like end of life care, so look at maybe what complications that might cause as well. And also there's the previous experiences people have as well that may put them off from maybe wanting to see a doctor or see a nurse. So try and link this to theory, the health promotion theories if you can. You then need to finally look at some potential conflicts between the tobacco and alcohol industry and the health promotion. So I know the tobacco industry is kind of collapsing now. We're seeing a lot of the factories shut due to, I think a lot of people have obviously quitting smoking. We've seen the electronic cigarettes. So what kind of complications that cause for the health promotion industry between those two? So there is a good PowerPoint that will help you in looking at that. There's also some articles on Google Classroom, so please check that out. And then you've got here finally the explain the importance of providing patients and family with information. So this could be video, it could be leaflets. What would happen if obviously patients didn't actually access this as well? So they're quite critical with that. So although it does say explain, I do want you to see some analytical work there looking at what the dangers if they don't have that information. But that may mean that they become maybe more ill or maybe not getting the right treatments. restricting that bit to access services because they don't know what's out there. There's some really good work in pages 44, 45 in Evans as well that will look at the importance of conveying the right message for professionals. So just to sum up, so there's some other instructions here. So first of all, please make sure you've read the module handbook carefully, ensure you've checked all handouts in lectures and on Google Classroom because there are lots on there. Be familiar with the content in Evans, the book, core reading, emphasising it once more. Ensure there's lots of in-text references throughout your work and at the back of a report, so making sure you link that to Harvard referencing, please. Because if you don't use that, it will obviously affect your final grade. I want to see that your work is structured correctly and has a good use of paragraphs throughout the report. And just to confirm again, your word count, I will double check for you and you should hopefully know that when watching this video what that is. So at the moment it's 1,000 words, but we might increase that. But you know, you do have 3 tasks and we don't want you to be too overly assessed. So this is for task 2 of your health promotion. Your 3rd task is your health campaign, which you'll be doing on the A1 sugar paper. You'll be having lots of guidance in class for your final lecture. Okay, but just to summarise what you are doing for your final one is you're planning a health promotion, so that could be linked to diabetes, it could be linked to HIV if you wanted to, it could be the flu vaccine, whatever you want it to be. Okay, and then once you've done that, you need to explain how the health promotion campaigns supports health promotion strategies. So you need to think about what the purpose of your campaign is. Is it to improve health for children? It's about improving concentration, encouraging healthy living, life expectancy. The strategies for your health promotion, so you're going to incorporate lots of routines, you're going to involve parents and carers, about cultural awareness. You can have festivals, special days, timing of levels of understanding. You're going to work with professionals in the community. So you need to think about, obviously, once you've planned your campaign, how you're going to make people aware of that. Are there any laws influencing your campaign, so like the Children Act or the Equality Act? And then finally, you need to be able to evaluate the effectiveness of your campaign, what you're going to do. So this will be linking to your SMART objectives, so specific, measurable, achievable, relevant and timely. Okay, so we need to see some evidence of that. So it can be done on your A1 sugar paper, you can have pictures on there, you can type it all up, put it in there, but we need to think about your purpose, your strategies you're going to use, are there any links to law, and finally evaluation. Best of luck. Any questions, please do ask me. Thank you.